Welcome to the University of California, San Francisco Sports Medicine Podcast, featuring Dr. Nirav Pandya, Dr. Brian Feely, and Dr. Drew Lansdowne, discussing hot topics in sports medicine and society. We hope you enjoy our podcast and look forward to hearing from you.
Welcome, everyone, to our UCSF Sports Medicine Podcast, 68 Weeks with myself, Dr. Nirav Pandya, and Dr. Brian Feely. So we have the pleasure of having two of our chief residents, Abhinav Janghala and Tiffany Liu, who are superstars and have great knowledge to share with everyone in terms of their experience here, why they may have chosen UC, and kind of where they're going off to next year. So maybe I'll start with you, Tiffany, first, and then Abhi can go next. Maybe just introduce yourselves, tell us a little bit about your background, and then we'll kind of go from there.
Sure. So thank you for having me. Really excited to get to chat with you guys. I grew up in Southern California, went to Princeton University, then med school at Penn Med before making my way back to California. And I will be going to HSS next year for a hand fellowship.
Abhi, why don't you go ahead?
Hey, I'm Abhi Janghala. I'm one of the other fifth years here. I grew up here in Fremont, California, about an hour away. I went to college at Berkeley and then stayed at medical school here at UCSF State for residency. I'm going to orthopedic trauma fellowship in Seattle next year. So thanks for having us.
So you're basically doing the 20-year UC plan. We like it. Around year 17, 18, we'll actually start paying you. So you all are chief residents. So you've been here for 5 years now. So when thinking back over the last 5 years, and maybe Abhi answer this first and then Tiffany, what is the most surprising thing about residency for you all?
I think the most surprising thing has been, as a student, you come in and you're like, oh, I've learned all about medicine. Now I'm going to specialize in orthopedics. And I'm going to learn about orthopedics. And it's going to be a fun learning thing. And then when you get into residency, you realize, yes, but it's actually a job. As a student, you don't really have a job. As a resident, you're actually employed to do a job, and you have to figure out how to learn at the same time. And I think a lot of people I've talked to, and myself as a student, didn't really realize how much of that aspect is the actual, the job aspect. And you're kind of learning on the job. That's residency, is an apprenticeship. So that was very surprising.
Tiffany, what about you?
I think that's definitely true. I would even go a little bit further and say that I think, residency can become as much of your life as you want it to be. I think when I was in medical school, when I was a sub-I, someone told me, like, you are this patient's doctor. If you don't do it, no one's going to do it. And I think that holds true in residency as well. You're not just there to learn orthopedics, as Abhi said. You're there to take care of the patients, and you're their doctor. And if you don't put in the orders, no one's going to do it. If you don't sign out to the weekend team, no one's going to sign out to them and follow up on the tasks. So it very much does become part of your life and who you are.
So I totally agree. I do think that's been a little bit of a culture shift since when Nirav and I went through, where when you were a sub-I, you sort of were a doctor, and you didn't actually have responsibility, but you could put in orders. They would always have to be co-signed, but you were kind of transitioning into a job mentality somewhere between third and fourth year. But now it is totally different, especially in medical school. It is a learning experience that you are paying for. And then orthopedic surgery residency, I totally agree. You are both trying to learn as a part-time job that's full-time, and then you are doing a job, which is a part-time job that's more than full-time, and always at 79.99, but never over 80 hours.
Right. And I think, kind of in line with that as well, too, I know it's obviously hard while you're in residency, and, I'm sure Brian would agree with the same thing, is that as you get further and further along, you see the benefits of residency. There are parts that really stick with you, and you see it as a very valuable experience, and you feel like, well, these are parts that were very rewarding and will shape me. Right now, kind of looking back over the past several years, what were the most rewarding parts for you in terms of residency?
I mean, I think the most rewarding part is actually becoming a physician, becoming a surgeon, taking care of patients. You are, when you go on rounds and you see patients in the clinic and you see them post-operatively, preoperatively, you are part of their medical team, and in some cases you are kind of their main physician, and that's been really rewarding. feel like we all kind of go into medicine to at least partly for that reason. And it's been really great to have that experience.
What about you,
Yeah.
Tiffany?
Yeah, totally agree. I know clinic's not popular, but seeing a patient in follow-up that you've operated on and seen preoperatively can be really nice when they're like, "Oh yeah, I remember you waking me up at 6 a.m. every morning, and 2 weeks later, I'm doing much better than when I was in the hospital." I think the other nice thing about being in a residency program, especially one like UCSF, is working with the junior residents and watching them grow. And yeah, I think that kind of helps me reflect on how much I've grown as well over the past 5 years. It's hard to notice your growth day to day, week to week, even block to block. But when you like are there teaching junior residents, or for me as a U chief, teaching the interns, it's really made me realize how much I have learned and developed over the past 5 years, and that's been really nice. And helping the juniors through it at this point, and watching them gain confidence in themselves is also very rewarding.
Yeah, I thought operating with Dr. Feely would be the most rewarding part of residency for me. But
Since neither of them are doing sports or peds, clearly we did not do our jobs effectively for these two.
yeah.
And we're done with sports and peds at this point as well. So you said be honest.
We are an honest residency. The attendings take feedback as well, even if it hurts our feelings. So I think Brian has the next question for you guys.
Yeah, so I think when people start residency and they start thinking that transition from med school into residency, you're worried about a myriad of things, like don't mess up, take care of patients well, please your attendings, please your senior residents, really please your sports attendings. What's been the biggest challenge for you at transitioning, especially in those first few years from medical student to junior resident?
I can start. So I think the most challenging thing for sure has been all about balance. A lot of people will say, especially early on when you're starting, like, don't think about balance. Like, this is your career. This is your 5 years to get in and learn as much as you can, do as much as you can, and can think about it afterwards. But I think in today's world, it's hard to approach it like that, because you have when you're a student, you just have a lot more time. As a junior resident, you don't have time. And it's not about we're getting overworked. Well, it's just that there's 24 hours in the day, and if you could work 18 hours and then do everything else in another 18 hours and have 36 hours a day, then that would be great. But that's not reality. So you have your health and your family and friends and your job and your research and your clinical skills and your just surgical skills, all these things. And how do you balance all those things? It's hard. It's difficult. I think that's been the most challenging.
And let me just butt in. You are not alone, Abhi. You have wife, children.
Yeah. Wife and 2 kids and a lot of family nearby, but still, at the end of the day, you still have to be a husband and a father and a brother and a son and all of those things. And on top of what you normally have. So you can't just silo and be like, I'm only going to be a resident, or I'm only going to be this. And for people that usually are getting into orthopedic surgery residency, who have been the best at what they do because they've been able to dedicate all their time to those things, you will not have that time anymore. You have limited time, and you have to figure out how to dedicate enough time to each thing to be successful.
And what about you, Tiffany? When you went from junior resident to senior resident, or from senior to chief resident, what's been the most challenging thing for that transition?
I think the transition from junior to senior is not as tough as the transition from med student to intern to junior resident. I think the learning curve is so steep initially that's probably been the most challenging part. I think going from junior to senior, I think the additional challenge is now you have the responsibility of leading a team and leading a service and teaching junior residents, and doing it at a point where I'm still not sure I'm I still don't feel qualified. I still don't feel like I've mastered any, like, the technical skills, the clinical judgment, and it's hard because now as a senior, as a chief, I feel like I'm running out of time. And so
we can keep you another year. Don't worry.
Oh, is this your way of telling me I'm being held back?
No. We call it a super chief year.
Yeah, like a red shirt year. Great. So yeah, it's just, I think just kind of the challenging part has just been moving on to the next step and learning the next skill while you still don't feel like you quite mastered the previous one. And it takes trust in yourself and confidence in yourself. That's been a challenge to maintain that throughout the years.
Yeah, I think you both made really good points. And one thing I think is really challenging as a junior resident is you really go into it knowing nothing. Orthopedic surgery, you may have gotten a couple months of, you got very sporadic coverage of it during med school. You may have spent a month on Legionnaire's disease, but an hour and a half on upper extremity anatomy, 0 time on frozen shoulder, and then you're expected to know a lot of stuff. And I still remember one of my friends, this was before cell phones, but he called and was like, I don't know which bone goes to which with a both bone forearm fracture. They both look like they could go together. I don't know how to reduce it. And I was like, well, describe what you're seeing. He's like, there's a long one and a longer one. But then there's shorter on the other end. I was like, 50-50, like what's the worst that can happen? And as a senior resident, you kind of go through that again, where you realize there's so much you don't know, but you have to you start becoming comfortable with, I will get that knowledge eventually, or I know what I don't know. And that means I'll just go read. And there's a more feeling of a tangible solution that based on all the knowledge you got for the 4 years before that.
Yeah.
And I think that kind of oh, sorry, go ahead. Yeah, go ahead.
I just said hopefully, otherwise
hopefully.
we will keep them back.
Kind of along with that as well too. I mean, with the limited kind of MSK education, get a med school, I think you then also get even more limited information in terms of what you should look for in a residency or what you should choose. I mean, you've got mentors, and sometimes it's just like, okay, this person wrote my letter and they think I should look for this program. Looking back at the process now, did you feel that you were looking at the right criteria or things, kind of more grand scale in terms of residency programs you're going to choose, or are there new factors that you feel that when you're advising med students, like what they should be looking for in a residency?
Well, I think everyone's different. And, at this point, thank God I'm not applying to residency, because I think it's become much more difficult than even 5 years ago. Yeah, I think I would still give people similar advice as to like kind of the criteria I used. I mean, when I rotated, when I interviewed, I was very much kind of just trusting my gut feeling and looking for, a place with a good culture where I felt I was going to fit in, and going off of the people that I met on my interview interactions. When I rotated at UCSF, I just got a really good feeling about how people were very willing to teach, and there was a very collegial atmosphere. And all, the seniors that I worked with seemed very competent and confident in their abilities, and they were role models that I wanted to become like when I grew up. And so I think that is still something that I would advise students to look out after. Like, I think all of this is now colored by the fact that matching into a program has become so much more difficult. So I don't feel like I have great advice on how to filter through all the play the numbers game. I think that's the worst part of it.
Yeah, and I when students come to me with this, I tell them like the 3 things that I looked at, and I still think those are the 3 things I would continue to counsel them on. And that was location. Where do you want to be? Whether that's close to family, friends, or a nice place that you just want to, a place that you would want to live in, because that's going to be 5 years of your life. The culture between the residents and the culture between the residents and attendings, and then where the residents end up. Do they go to good fellowships? Do they, kind of get the career choices that they wanted to have? And I think that's all been proven true here. I mean, I had the reasons to be here in terms of location, but in terms of the culture of the residents, culture between residents and attendings, the fact that we can on a Sunday evening have a casual talk like this and do a podcast, and it's very comfortable. Tiffany and I have grown to become really good friends over the last 5 years. So, and that's kind of same in our whole residency. And it's been, everyone has kind of is getting to where they want to be. So that's what I would tell students to look for.
So neither of you chose sports or peds. So I feel like this is a fair question to ask. And I'll start with you, Tiffany. What made you decide hand over everything else?
There were a lot of factors. I think a big part was the mentorship that I received here. I had a great experience on my hand rotation, and felt like the attendings I thought were all great teachers. And I had a great experience. I mean, there are other things like I think the other standard answer is, I love hand anatomy. I love the variety of procedures you do in hand. I love the spectrum of diseases you treat from, sports type procedures to arthroplasties to fracture surgery. And there's the soft tissue work. So I think there's a ton of reasons that I chose hand, but a big part of that was the mentorship I received and the great experience I had with the hand attendings. Not to say anything negative about sports or peds, but
No,
yeah.
you're okay. And Nirev's getting bombarded by My Little Pony stuffies in the background. So
this is work-life balance. I'm managing multiple things right now.
What about you, Abhi? When did you decide to do trauma, and what kind of tipped the scales for that for you?
Yeah, through residency, I actually like most, if not all, of my rotations, and I actually decided pretty late. I decided at the beginning of fourth year, and it was after my we have kind of a cold trauma experience here with Dr. Morshan Kandemir that we do as a fourth year, and similar to Tiffany, like working with them directly, getting that mentorship kind of tipped the scales. But I liked everything, and trauma I feel like allows you to operate all over the body, which is another thing. You have to have good anatomy knowledge all over the body, operate everywhere. The type of people, like Tiffany said, the type of people that were our trauma surgeons here, I feel like I meshed with well. And I think the other main thing was the indications. I feel like there's certain surgeries where the indications are very clear, and I really like that about trauma. And so that was the other reason.
Kind of our last question, kind of wrapping up here. If you could tell yourself, if you took your 2022 self and could go back to 2017, besides telling them to go into peds or sports, what would you tell your 2017 Abhi or Tiffany?
I would say, I guess it's not as relevant now because there's so many. It's like getting harder and harder to get in. But apply to less programs. Like really apply to the programs that you would want to be at and that you see yourself being at. And then secondly, brace yourself, because no matter what you do, it's not going to be what you think. It's going to be harder than what you think. And there's going to be obstacles that you couldn't think of and can't prepare for, but you just have to be ready and just roll with the punches.
All right, Tiffany, what would you tell 2017 Abhi? Sorry, 2017.
Also tell him, brace yourself. You have no idea what's coming. You're getting me as a co-resident, so good luck. I think the other thing I would tell someone who's about to enter residency is just kind of, the days are long and the days are hard, but don't take them for granted. It is an educational experience, and pretty soon you'll be sitting in my shoes about to graduate. And like I said before, there's so much I still have to learn, and all of intern year, junior residency, those are all learning opportunities that to take advantage of. And you'll see yourself grow. And so, definitely take advantage of the time that you have with your co-residents and your attendings, and, pick their brain.
Well, we don't want to take up too much of your time, Tiffany and Abhi. Once again, thanks for joining our podcast. We're excited for another group of applicants to come in this year, and hopefully another great group of great residents to train with us. And once again, thanks for taking your time on a Sunday evening. We really appreciate it.
Yeah, of course.
Yeah,
Thanks for having us.